458. We are putting an insert peripheral IV as needed, and then we have an order to flush with 0.9% normal saline, 2 mLs per PIV. So first step is to gather my supplies. So we're going to grab gloves. I'm going to grab my normal saline, which I'm checking to make sure that it's not expired. We're good. Tourniquet, tape, some gauze, IV tubing, chloroprep, tegaderm, and a syringe. This is a 22 gauge syringe, and let's see. Okay. All right, so we're good to go. So we're going to walk into the patient's room. Hello, my name is Evelyn. I'll be your nurse for today. Can you tell me your first and last name? And then we're just going to check the name bag. Tell me your date of birth. 7/4/58. Okay. Mr. Miller, do you have any allergies that I need to know of? No? Okay. And then earlier we talked about inserting a peripheral IV, and you said that your right arm would be okay. Is that still okay? Okay. So the reason we're putting this IV is so that you can get medicine in per doctor's order. Okay? So first we're going to just assess your site here. Just going to put this tourniquet under your arm. And I see I already set up the chucks from earlier. So I'm assessing his arm to make sure there's no, that skin integrity is good. Okay, you have really good veins, Mr. Miller. So we're gonna take off this tourniquet while I prepare. All right. So I'm gonna open everything. I'm gonna take the tape off. Okay, so we're ready to start. Clean my hands again. Clean my hands a lot. Oh, I'm gonna prep this tape too. Before I do that, sorry. You doing okay, Mr. Miller? Okay. If at any time during this procedure, if you have any pain or discomfort, you let me know. Okay. I need a different pair of gloves. We're gonna do. Okay, wash my hands again. Okay, first thing I'm gonna do is clean your arm with this chloroprep. We're gonna clean for 30 seconds. So start. Okay, that's 30 seconds. We're gonna get rid of this. All right, we're gonna apply the tourniquet. So that I can quickly release it. Okay. While that's waiting, I'm gonna undo this for a second. While that's waiting to dry, I'm gonna prepare my tube. Without touching that, we're gonna connect. So I'm flushing to check for patency and to prime the tubing, so that's good. I'm gonna loosen the cap. Okay, and I'm gonna set this back here. All right, now I'm gonna put the tourniquet on without touching the clean site. All right, we're good to go. So I have my 22 gauge syringe. I have the bevel side up. I'm gonna pull your skin taut, and we're gonna go in at a 10 to 30 degree angle. I see a flash, so now I'm gonna go in another 1/8 of an inch. I'm going to engage the safety, release the tourniquet. Now we're going to insert the flush. I'm going to apply the Tegaderm. Once that's applied, I can release my hands. Next step is I'm going to check for blood return. Okay, see blood return. So now per policy, I'm going to flush with 2 cc's, 2 mLs. Okay, after that, I'm going to close the clamp while doing a positive pressure. Okay, we're disconnecting. Then I'm going to, let's see. Okay, I'm going to tape this to your arm. You did really good, Mr. Miller. So now we're just going to date. We're going to put the date and your initials on this. And then label that. And just write the date and your initials. And then we're going to clean up our procedure. So this is going to go into the sharps. This normal saline is going to go into the sharps. Everything else can go into the garbage. We're going to document which arm I use. So I used his right arm, a 22 gauge needle. Resident tolerated it well. We saw blood return, and we flushed with 2 mLs of normal saline, and what else did we document? I believe that's it. So we did the needle that we used, we saw blood return, which arm, how he tolerated it. I think that's it. Okay.